Documenting stroke education and discharge of a stroke patient. This is for Meditech on both inpatient and ED patients. Stroke education for patients. Someone once said, if it is not documented as done, it was never done. This is so true, especially in the stroke world. Documenting stroke education. New in Meditech, you will find where you can document on patients' connect-to-place education. When you click on the intervention for stroke education, it will open and you will see what appears on your screen. In order to document the TNK education, you will first click the box next to the TNK education. This is required only if the patient has received TNK in the ED or as an inpatient. In the education detail, you will go down to that box, click inside the box, and type handout given, and also type discussed with whoever you or the MD discussed it with. So, if you or the MD discussed it with the patient's family, do not just put patient's family, put down the relationship of the family member and the family member's name, such as wife Mary Jo and son William Shepard. Also, be sure to put down which MD and which nurse discussed this with the patient. When documenting patient stroke education, you must document the patient's risk factors. This was noted in our DNV survey this December. These risk factors must be specific and personalized to that patient's plan of care. To do this, you will open up the intervention called Stroke Education, put a check mark in the box next to the risk factors. In the Stroke Education detail, this is where you will write the patient's risk factors that you discussed, such as diabetes, AFib, hypertension, high cholesterol, etc. This way, we are giving the person personalized education to their specific risk factors. Each time you discuss any of these risk factors with the patient or the patient's family, it should be noted in the chart that the education was discussed. You would document all instances this way. Also, make sure that the patient has been given the stroke book and all other required teaching has been completed. If you are on the floor that does not have any of the stroke education books in stock, please be sure to get one from either 3 West or 6 West to give to your patient. As a recap, for the patient's stroke education, you can now document TNK education under the stroke education intervention. This can be done in the ED as well as on the floors. Make sure that the patient and/or the patient's family has received the TNK education handout and all questions have been answered. Risk factor education must be personalized for each stroke patient. To do this, you will go to the Stroke Education Intervention, click on Risk Factors, and in the Education detail, add specifically what risk factors the patient has and those that you discussed with the patient or the patient's family and who you discussed it with. Discharge of a stroke patient. Do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can. said by John Wesley. Discharging your stroke patient correctly is one of the most important interventions a nurse can do for the stroke patient. Remember, your stroke patients include ischemic strokes, TIAs, or hemorrhagic strokes. These patients are under a lot of stress. Their families are under a lot of stress. They're very concerned and they are also confused. They don't all understand all of these big words that are being thrown at them. Please speak slowly and make sure that they are listening and paying attention to what you are telling them. Be sure that the patient's medication reconciliation has been completed correctly. One way to do this is to ask yourself the following questions. Does the patient have AFib? If you answered yes to this question, is the patient on an anticoagulant or is there a reason that the patient is not? If the patient has a hemorrhage, is it documented not to take the antiplatelet or anticoagulant on the discharge papers, especially if the patient had been on one prior to the hemorrhage episode? Is the patient being discharged on a statin, or is it noted in the patient's chart that the patient does not need a statin because the LDL is less than 70? If the patient is the patient discharged on aspirin or another antiplatelet? All stroke patients, except for hemorrhages or those that are on anticoagulation, need to be discharged on at least one antiplatelet medication. The medication reconciliation must be fully completed for every single patient, even if the patient is going to PM&R. Recently, we have had multiple fallouts because the medication reconciliation is not completed before the patient goes to PM&R, and therefore, technically, the patient was not discharged on a statin. If the documentation is not correct or has not been completed, call the provider who is responsible for that medication to complete the documentation. Before you discharge the patient, ask yourself the following questions about the rest of the patient's care. Is the pre-morbid, meaning before the patient had his stroke, is the modified Rankin scale documented? And did I complete the discharge modified Rankin scale? Did I complete the discharge NIH scale? Did the patient receive all of the required stroke education, personalized stroke education for the patient's risk factors? Does the patient have a follow-up appointment at the NSI clinic with either the stroke team or with neurosurgery? Did the patient get tenecteplase? For patients that received tenecteplase, on the discharge screen, proceed down to the area that says Forms. Click on the word New next to where the word Form is, and then select TNK Education. This will allow for the TNK Education form to actually print out with the patient's discharge papers and will be a record that the patient actually did receive the form and the education. When you click on the word New next to the forms, the Select Form screen will open. Place a check mark next to the TNK Education, as seen in the screen below. TNK use in acute ischemic stroke will then print out with the rest of your discharge papers. Remember, to get this education to print out, you must have done the following. Go to the discharge screen, go to the box labeled Forms, click on New, and then select TNK Education. Any of the forms listed here in the discharge form section can be attached to your patient's discharge record if they pertain to your patient. They will then print out when you print out all of the discharge paperwork. Over the next few months, we will begin to increase the amount of discharge information that is available in this section. We are hopeful to include most of the risk factors that our patients may have. These will be added in the near future as they become available. Some examples will be groin and wrist care post-procedure, tips on dieting and exercise, tips on monitoring your blood pressure and your glucose levels. This conducts the presentation on stroke education for our patients and discharging our stroke patients. Thank you for taking the time to learn how to properly document education on our patients and to discharge them with the information that they will need once they get home. Your help in getting the stroke patients this information upfront and detailed concerning their care will help both them and their families to relax a bit once they are home. It will also help to prevent readmissions and keep them safe. The Stroke Program thanks you for all you do for our patients. Thank you.